Hi, I'm Dr. Lucy Hostetter, founder of Seattle Regenerative Medicine Center. Today I want to talk about stem cell therapy. This is one of my favorite treatments that we offer here because it can be so effective and offer long-term benefits to so many patients who suffer with pain. Typically, I use stem cell therapy to treat orthopedic conditions, specifically conditions involving osteoarthritis in the joint, perhaps meniscal tears in the knee, as well as tendon injuries like tennis elbow or rotator cuff injuries. A good candidate for this type of treatment is someone who has pain that affects their daily life or affects their ability to do the things they like to do, but their disease is not so advanced that we would consider it end stage. And what I mean by that is that they have advanced so far that really the only option left to them is surgery. If we're talking about, as an example, in the knee, if your bones are right atop each other, bone on bone, and you have no space between them, you're likely not a good candidate for stem cell therapy. However, if you still have maybe mild to moderate osteoarthritis, which can still cause quite a bit of pain and affect your daily life, but you have some cartilage left and you have some joint space there, then you very likely are a good candidate. Here at Seattle Regenerative Medicine Center, though, we make sure to review all of your images beforehand, and we are honest with you and let you know before you even come in for a consultation whether you're a candidate or not, just based on the imaging, so that we don't waste your time. When you come in, a typical consultation will involve meeting with me. We talk about your condition, what is the pain that you're having, what caused it, what trauma or injury have you had, what surgeries, what other procedures have you had and had they worked or have they not. I'll do an examination. I typically do ultrasound exam as well of whatever the affected area is, and then we'll talk about whether stem cell therapy is right for you. If stem cell therapy is a good option for you, and if you choose to make that investment in your condition and in your health, it is a really relatively simple and straightforward procedure. Many times people become really afraid about the idea of having their stem cells taken from bone marrow. The nice thing is here we have a surgical suite in office. We allow you to have sedation so you can sleep through the entire procedure. It typically takes me less than 5 minutes to get the stem cells from your bone marrow and less than 2 minutes to inject your affected area. So the total time from when you come in to when you leave is usually less than an hour. Most patients will have a little discomfort for a couple of days after the procedure, but then go back to baseline within 2 to 4 days. On average, it takes about 4 to 6 weeks for most people to see results. And with stem cell therapy, once you start to notice improvement, that improvement can continue on for months. It is not atypical that I have a patient 9 or 12 months down the line from their procedure say, I'm still getting better. I still notice I'm better than I was last month. So if you're suffering with joint pain, musculoskeletal pain, you have tendon injury, meniscal tear, whatever your issue is, and you want to be considered for stem cell therapy and find out if you're a candidate, give us a call here at Seattle Regenerative Medicine Center. We'd be happy to see you.